There's growing demand for healthcare services that are available to the public in their own homes. The reasons have to do with tradition, with technology, and with cost effectiveness. Home care is the oldest form of healthcare, and in a way, it's also the newest. Modern technology has developed to the point where many services that are available in the hospital can now be provided at home. There is significant evidence that it is less costly than other forms of care, and that it is the most satisfying form of healthcare available to the American public. It's an idea whose time has come.
There's other facilities and long-term care facilities, nursing homes, retirement facilities, and there's a certain section of the community that's the right answer for them. But there's a large segment of people that want to remain in their own home. They want to age in place. And so from our perspective, we provide them the ability to do that.
It could be as much as just going there and assisting them with meal preparation, with the bathing, with light housekeeping. We can run errands for them. We can pick up their medications from the pharmacy. Many things like that.
Our elderly would suffer from loneliness probably more than anything else. And to have someone come in and not only take care of their physical needs, but to be there as a companion and to be there as a friend, it makes a huge difference, and it saves a lot of medical bills because it avoids falls, it avoids depression. There's a lot of benefits that come from our services.
I don't think there's anybody out there that would say they'd prefer to leave the home that they love, that they may have raised their family in, to go to a new community in their 80s. I wouldn't want to do it now, so I can't imagine down the road wanting to do that. And in-home care is an option now for seniors that they didn't have years ago.
We just feel like we're doubly and triply and on blessed to be able to stay in our home, because this is where we have happy memories and we feel comfortable and we know it's safe. We've got good neighbors.
It's a fairly new phenomenon, I'd say the last 10 plus years. Before that, it was family and or a facility. But when you look at it from the loved one, the client's perspective, neither one of those two options were what they wanted. The option that they wanted was to be able to stay in their own home.
I think the benefits of in-home care are preserving the well-being of the individual. The most comfortable thing for an elderly person to do is not to move out of their home. I know my personal situation with my parents at age 85 and 87. They dug their heels in and they said, we are not leaving our beautiful home. Regardless of what you kids think we should do, we are staying in our home. So then we had to look at alternatives and found
care. There's nothing wrong with long-term care facilities, but the average stay in a nursing home is only 2 years. And you know that there's people been in those nursing homes for 10, 12, 15 years. So statistically, there has to be a lot of people that weren't in those homes for very long. And what happens, what my wife has seen and what we have seen now in this business is that people who do end up having to go to a nursing home give up hope. They just give up the hope and the will to live. Whereas if they could have just stayed in their home and had someone help them with the 20 hours a week to do the things that they couldn't have done, they could have lived a much happier and healthier life.
Probably 90+% of the people I see do better in the home. I think for the mere fact they're happier in the home. They get to, be in a familiar environment and setting that they're comfortable in. A lot of elderly, especially with dementia, when they go into an alternative place, they become more confused, they become more depressed. And that's with any of us. I think we all like to be around our family, around our home, and we're much happier that way.
One night my mother fell on the floor and spent 5 hours on the floor with nobody around to take care of her. And unfortunately after that, we elected to put my mother into a nursing facility, a very nice nursing facility, but one in upstate New York where she lived, and tried to keep her close to where her friends were. She went downhill very rapidly. And we believe that if she had stayed home and had the care at home, that her health would have been, and her life would have been extended.
I've seen studies that of course, statistically would tell you that in-home care will allow a senior to live more years than if they go into a facility or a nursing home. But on a personal level, I can tell you that when my grandmother was put in a facility, she lived 6 months after she went in there. And I know that if we could have brought a caregiver into her home and taken care of her on a one-on-one basis, she'd have probably lived another 6 to 10 years. You have one-on-one care. You're able to develop a relationship with that senior, which they need more than anything else. Seniors need love, they need compatibility, and they need somebody that cares about them. They don't get that in a nursing home where you've got one person taking care of 30 patients.
The people that were selected to care for my mother just were a good match. My mother liked them. My mother liked her caregivers, and I know that they grew to love my mother.
When the senior needs help, he gets it immediately. In other areas, arenas, where there's not that one-on-one care, they don't get the quick, concerned care that they need in a timely manner.
I think it's the one-on-one, the personal care that you get. It's a friend, it's someone who's there to take care of you. It's not someone who's trying to take care of 25 other people as well as you, and you're a number on the list.
Usually we are the right answer, and the reason we're the right answer is, number one, we can help that elderly person to continue to live at home, which is where they really want to be. We can help them to do that without burdening their other family members, which is something that they are usually more concerned about than their family members are. And we can give those family members a sense of security that their loved one is going to be taken, not so much to be taken care of, but to be supported in the same way that they would if they were there, and they can manage their lives with the peace of mind that that brings.